was speaking to a physician recently who was telling me the story that they were seeing a patient for the first time, and the patient was with family, and they were listening to the family talk about what has been going on along with the patient. But when the family talked about what had been going on, they recognized that the family was referring to the patient with they pronouns. And this is an amazing physician. I adore this physician. They're incredible. And not surprisingly, they picked up on the fact that the family was using they pronouns. And so the first time the physician spoke, the physician used they pronouns. And this physician said they noticeably noticed as soon as the pronoun they came out of their mouth, the physician's mouth, the family's and the patient's body language like relaxed, like it had been tensed up tight. And the minute that they heard this physician refer to the patient with they pronouns, their body completely relaxed. And this is what I want to talk about today. This story did not surprise me. From over a decade of talking to people within the transgender community, helping families, etc., this doesn't surprise me. Many people, families, and transgender non-binary individuals have had negative experiences at the hands of healthcare. Not every experience, but it doesn't take long to have one negative one. And I think what makes it the hardest, because people can navigate negative experiences not affirming their gender in many places, but in healthcare, I think it's the hardest. And other people may have different opinions, but here's why I think it's the hardest. I think it's the hardest because gender diversity is a biological diversity like so many other things. And we really expect healthcare providers to know. Now, I know on the other side of things, of healthcare providers, a lot of the science and the information is newer. Most of us weren't taught in medical school. Having said that, I think what we are taught is an openness to who people are, an openness to a variety of things about people and their identities. But I think from the patient perspective, when that thing that is biological is not understood by physicians, when they have to teach their physicians, etc., it feels like another denial of who they are. And so this is part of the problem. And so then it becomes almost an anticipation, because if you have that experience of somebody not affirming your identity in healthcare, particularly, I find a lot of people, a lot of stories, families included, supporting and affirming families included, leave those appointments and then feel like they need to recover. They need to take care of themselves. They need to cry. They need to let it out. They need to be, whatever they do. It's very hard because it feels like, what is wrong? Why do people not understand? Why do the people that we trust to understand about biology not understand? And not only not understand, but can't even be respectful and affirming. And I just want to say on the healthcare side of things that it's not always intentional. It is not always that you don't affirm or respect. You just haven't been taught. You don't know. You haven't thought about how you approach the patient, how you approach the history, to do it in a way that can welcome everybody, that can include everybody. But that doesn't change the fact of the patient's experience and why they may come to an appointment uptight, why, like that physician described, like didn't realize the body language of the patient and the family until the word they came out of their mouth and they visibly saw the bodies relax, the muscles relax. And so that's what I want to focus on, is thinking about what it's like as a healthcare provider, because you have to understand that when I talk about negative experiences in healthcare, there are so many places where that happens, whether that is from the moment you walk in, and depending on what a clinic or hospital is like, sometimes some clinics have, if they're especially in big places with multiple, multiple disciplines, multiple specialties. Sometimes you have to go and check in at a place that tells you where you're going to make sure that you have an appointment there. And so there's that interaction. And at least around where I live, many times they have to type you in and have your name come up and verify that you have an appointment, and they point you in the right direction. Then you have to go there and you have to check in, and the same thing. And then you're taken back by somebody in healthcare from the waiting room to the examining room, and you have some interaction with them, and they're going to have do a history, and they might take some vital signs like blood pressure and heart rate, and then you see the physician, and maybe even depending where you are, you might even see a medical student or a resident first, as well, and the physician or the nurse practitioner or the physician's assistant. You get the idea. So there are multiple pieces along the way where somebody can use the wrong name, somebody can use the wrong pronoun, that somebody makes assumptions on a person's identity or appearance. And so this is what I truly believe, because I truly believe the heart of healthcare is still to help people. There are so many things healthcare workers are dealing with, so many different pressures, time pressures, administrative pressures, etc. And I truly believe at the heart of things is still wanting to help people. I don't think that has ever changed. And so that's why I encourage healthcare providers and organizations to get training. It doesn't take a lot of time. It does take some time, but it doesn't take a lot of time to do the work to understand where. And it's not just about adding another field in, in your questionnaire of something to fill out. It is about practice. It's about understanding. It's truly understanding gender, not a list of things to memorize. And I think we can do better. I believe in training everybody in the system, from the person that greets you until the last person you see, all that kind of list of things. And the reason I think this is so important is because I think it changes the experience for the patient. As you can imagine, if you go in and you are not affirmed, and this happens, let me give you a story. Okay, I'm going to tell you what happens when you're not affirmed, but let me give you an example, because you might think like, okay, like, I don't know. I hear all the things of why, it's a little thing. It's this, it's not a big deal. Why are you making a big deal? Let me give you an example that I think we all can agree is not a small deal. And I have permission to share the story. Ever since I was first told the story, a parent took their child into the ER. And unfortunately, ER is a place where this happens a lot. And we'll talk about that in a second. But took their child into the ER for something, and was first kind of assessed by the nurse, and the legal name had not been changed. So the parent said, this, my child is transgender. This is the name they use. Can you please use this name and not the one on the chart? And according to the parent, the nurse looked at them for a second and then yelled across the ER, the patient's dead name, as we call it, or birth name or legal name, whatever you want to call it, but often called the dead name. So specifically being asked not to use that name, in defiance, this nurse yelled the patient's name that they were just requested not to use, standing right next to the patient, across the entire emergency room for multiple people to hear. This is not an unusual story, unfortunately. I do think over the years it's getting better, but it is not gone. And I want you to know these stories so that you have some empathy for the patients coming into you. If you notice their bodies uptight, if you notice them kind of on guard and being defensive, this is why. Things like this happen all the time. And there are milder things that are not as intentional as that story. There are times where patients' symptoms get dismissed as psychosomatic, because they are transgender or non-binary. It so there are multiple experiences. It's I would not brush it off. I think there's a tendency to be like, people get so upset in unintentional mistake. And I often say this, like even when someone's like, I'm supportive, I normally use the right pronouns, I can't be responsible for a traumatic thing because one time I messed up. And you have to understand that it's not that one time. I mean, you are going to mess up. And that's why I teach people how to handle mistakes, which decreases that being a traumatic, that being an unaffirming event. If you know how to handle mistakes, it doesn't have to be an unaffirming event. And you have to understand that from their patient's response is often coming because of all this history, from the stories they've heard from other people. I mean, if I've heard this many stories, we all have heard a lot of stories that are sitting listening to the transgender non-binary community. So, and I would say, I don't think I've met a person or a family who has a transgender non-binary person in their family that hasn't experienced a negative experience. I've shared on an earlier podcast that I have loved ones who are transgender, and yes, they have experienced negative experiences in healthcare. So the reason I tell this to you is not to make healthcare the bad guy, because I don't think they are. I just think healthcare hasn't had the opportunity to learn and take the time to understand. Some people have, but a lot of the system has not. And this is why I think it's of value, because we can better take care of our patients. So what I was going to tell you before I told you that story of the patient in the ER is that imagine if that happened. How forthcoming are they going to be with you about their history? How much are they going to trust you? Do you know what I mean? Like, they may not tell you all their history because now there's a symbol of judgment. And so this is what I mean about by doing better. It's about affirming the patient, but it's also about providing better care. We refer to using people's names and pronouns as part of gender affirming care, and this is why. We establish a relationship of trust when we can do that. And then we can better take care of the patient, because then they're going to share with us more they're going to trust us to share what's going on. They're going to trust us. I mean, think about the questions we ask as healthcare providers. We ask very personal questions, and especially for me as an OBGYN, very personal questions. I realize that everyone doesn't take a past sexual history, but I do. I did, I should say. And so we ask very personal questions. If you want honest answers, you've got to establish that trust. So that's why I think it will help. It will help to have the training, to have the understanding. And like I said, it doesn't take a lot of time. It takes some time. But in short bits, you can work on understanding gender, work on understanding where in your practice you can do better, where you cannot stop yourself from making assumptions. And many people that do the work find that they take care of all their patients better because it reminds them to stop making assumptions and slow down. But I want to play through the story I often hear from healthcare providers. Many healthcare providers have said that when they have a transgender non-binary patient and their families, that they almost feel like on attack, like they almost feel a defensiveness and anger, a frustration from the patient when they haven't done anything. I haven't done anything. I haven't said anything that would not affirm the patient, but they feel like the minute they step in, it's like they think I'm going to do something wrong. They think they don't trust me. They like all those things. And so if you have that thought and you come in and you're not thinking about what this patient has been through, you don't have the information that I've been sharing with you today of what may be going into before they've even stepped in the room, whether that day or another day or something else. Because it is so common to have negative experiences, most people are bracing themselves. Most families and patients who are transgender, non-binary are bracing themselves for what could occur. trying to prepare themselves. I don't think it's very effective, but that's another story. Trying to prepare themselves to fight for the care that they need. And yes, fight. That's what it feels like you might have to do to not be dismissed, to fight for being affirmed, to fight to being respected. So a lot of times that energy, just like that initial story, that physician that, recognized when the body relaxed how tight it had been for that family, it makes sense that it's like that. But if we go into work with that patient with the idea, okay, what is their problem? Why are they so angry? I haven't done anything. They're just waiting for me to mess up. And then how do you feel when you think that? They're just waiting for me to mess up. Then you might feel defensive, you might feel angry, and then think about how you're going to show up. You are going to show up maybe short, not, short in response, not listening. You might be dismissive. You might be argumentative rather. And when we are that, when we're defensive and when we're argumentative and we're defending what we're thinking, we're not listening. And so what that creates is then you do mess up. You are not practicing medicine to the best of your ability because you're so busy guarding and defending yourself. And that's human. But it's not what you want to do. Many times people don't feel amazing about that afterwards. But it comes from, if we're thinking on that angry, defensive, like they think we're going to mess up. They're already against me. Look how angry they are. I haven't even done anything, right? But what if we take it from a different angle? The minute you notice that kind of frustration, defensiveness coming from your patient, what if we thought about, they think I'm going to mess up? And then add to that, because they must have been through a lot. I'm going to have to build trust. And then notice how you feel. They must have been through a lot. I want to take the best care of them I can. It's going to require me to build trust. Notice how you feel. I'm guessing that you're going to feel more empathetic. And when you feel that empathy, then you're going to slow down. You're going to be a better listener. You're probably going to explain things a little bit better and calmer. You might ask for more consent over things, making sure you have agreement and understanding on the things that you're doing. And then that's what you do. You build trust. That's what you create by slowing down and having that empathy. That is the point of today. That is the point of this podcast. I want you just to understand you to understand the patience coming in towards you. And if you notice that kind of angry, defensive energy, now, as everything in life and biology, there's not always and never, it's not always going to be this way. But if you feel like a patient's coming at you argumentative from the get-go, consider this, consider what they're coming from. And then the other part is being aware of yourself, noticing what you're thinking when you start thinking, man, they're after me, like they're coming after me, right? Like I didn't even do anything wrong. It leads to you doing things wrong versus, wow, they must have been through a lot. I'm going to help build trust. I'm going to do everything I can to gain their trust. And then that's what you create when you come from that energy, that thought that creates that empathy. So if you have any questions, if you have any thoughts, please reach out to me at shannon@engenderlove.com. I think together we can do better in healthcare. We can make it the thing that we hoped when we first went to medical school. And we said, the reason we're here is we want to help people. You are helping people, and you can do it even better. Continue to engender love and have a great week.